Hello, dear colleagues. How are you? It's a late evening in Almaty, Kazakhstan, Central Asia. My name is Mynzhylky Berdikhojayev, and together with my colleague Davlet Suyumbetov, we took patient number 4 for the live streaming, but from the morning it's a patient number 7. We have one more patient, and this patient previously ruptured and had a coiled 3 aneurysms and already, and there is another 2 aneurysms, paraclinoid on the right side, cavernous segment right side, and нені қоясаш ревьюда, Давид. Okay, this is a 2D. Vertebral territory is clear. Patient is 44 years old. This is 2D. I think the cavernous segment it's not so significant, but if we'll place braided stent, it will be prophylaxis of growth of the aneurysm. ACOM aneurysm is clear, coiled. PCOM segment on the right side clear, coiled, and the left ophthalmic segment aneurysm is clear and coiled. Maybe ½ millimeter at the neck part. It's not so significant. We will follow. And patient under control. And now we have remaining 2 aneurysms on the right carotid territory. There is a interposition with coils, and the hypophyseal artery is forming the ophthalmic. It's a low positioning of the ophthalmic artery. Option number 1, we can place braided stent and braided stent inside, and option number 2, we can place FD to treat the remaining aneurysms on the right side. Okay, the artery diameter is 3 millimeter on the right side. Қозғалмай жата беріңіз. We have a Elvis Evo and we have a Leo baby stent. It's also possible to treat with Leo baby, Leo plus 3.5. Or we can place Elvis Evo. Evo inside the Evo, it's possible 3.5 and 4 millimeter Evo. 2 Evo inside Evo. Because the FDs, we have Fred 4.5, Derivo 4.5, and HPC 64 4.5 millimeter. Okay, let's start with the 3.5 Evo, then we will see. Usually Evo it works. На наш период. Так, Xeon Blue Aspirasol. And let's take headway 17. Okay. Так, Xeon Blue и на наш период. Yes, unfortunately, the most of the stents flow diverting is 4.5 millimeter. Headway. Yes, Davlet Suyumbetov assisting me. This guy without glasses. Дәулет очки киіп алса. Защитный очки киіп жүрсе. Айту керек қой, сынып қалып, сатып алып беріңіз. Хрусталиктің ағылшыншасы қалай болады екен? The eyes are important when you work with the radiation. It may go to cataract. Қозғалмай жатыңыз, екі аневризма бар екен, қазір соған стенд қоямыз, жақсы ма? Екеу. Ана алдындағы үш аневризмаңыз жақсы, жабық тұр. Но екі кішкентай, ана саңырауқұлақтар сияқты шығып қапты, да? Соны қазір жабамыз, содан кейін бәрі жақсы болады. Құдай қаласа. Сүре қосып қоя сал. Так, бетим мынаны алып тастайсыз. Yes, Дәулет is graduated MBA, and all the time I'm talking about Kaizen, and he knows what is Kaizen, and this is every time should be at the same position to prevent from mistakes and to save my time during the intervention, but all the time the same things, and I have no idea why it's like this all the time. Yes, the Kaizen is a Japanese terminology, but I think the Mr. Ford, Mr. Ford from United States did the same. He was a master from Kaizen, and he could organize the manufacture of one of the best cars in the history, which was the Ford machines. Yeah, yes, and my teacher and friend René Chapeau, he introduced for the clinical practice Chapeau table, which is also the standardizing the approach. But we have no Chapeau table. We need to pay for everything from our pocket. That's why maybe in a private hospital in the future we will have a Chapeau table. Abelens. Also, I met the company, European company, I think. I forgot the name of the company. They made a table for intervention from the carbon, and it's fully visible. Okay, but it's a little bit different than Chapeau table. Okay. Yes, on the lateral view you can see there is aneurysm in paraclinial segment. There is a double contour. Okay. Now the catheter is trying to go to the pico aneurysma, but we don't need to go there. Lower branch is better, and once again 44 years old lady, and treatment under local anesthesia. Heparin basement. We will place LVCO first. Kit твой, да? Jitted. Heparin is on board and patient is premedicated with ticagrelor. Preventive, да? Brilliant. Yes, it's a local generic, which is Terventin from the company Abdi Ibrahim. It's a Turkish company, and they are located in Almaty. Peter Kush? Yes, comparing with the clopidogrel, which is also local in 2 hospitals. Clopidogrel, which is producing in 2 manufactories in Kazakhstan. One in Almaty is more effective and it's reliable, and the second one is not in Almaty, and it's in my personal point of view less reliable, but it's just a personal point of view. Could be non-correct. That's why it's a personal view for the medicament. Okay, we placed LVCO because we had no. Okay, it's in upper branch territory. Now we compressed a little bit the stent. It's a problem, huh? I couldn't pass the segment. Okay, now it's better. Now we're inside the stent. Then we can. Yes, I'm touching all of the stent. That's it. That's the control angio. With this stent, we covered the paraclinite aneurysm. But I will recommend to Gaulit to place one more to do telescopic. Okay? I like the idea of telescoping the LVCO. I specially placed with covering the Yes, in the future it may be the question of recanalization. That's why I tried to prevent this from now. Okay. Now it's J-curved, and I hope it will go. Yes, now it's better. And this one we learned from René. It's a Xeon blue wire through the headway 17, and in less complex anatomy we're using this tips and tricks with the 14 coronary wire system. 14 wire system. Okay, now we are in MCA. Tört.
Tört taşı. Şu an ilginçten tört.
Okay. Yes, we'll overlay the telescope the two EVOs, and then it will be for the advertisement. We have no FD less than 4 mm, that's why we're creating self-made FD. Gitme. Kas tur? Šeit ir. Yes, we specially used Headway 17 because we had a couple of times problems with delivery of the LVC was through the Gamma 17, which the microcatheter from Balt company, and we sent the samples to Microvention company, which is Tirumanero now, and the recommendation from the company was to use the microcatheter recommended from company, which is Headway 17. Yes, now it's fully opened, I hope. Yes, and the problem of EVO might be the visibility. But now we can see it clearly. The stent is opened. Okay, we can compress a little bit in paraclinoid segment. I think it's opened. No, it's fully opened. Okay. Okay. The second stand is opened, and idea came also from Rene in basilar dolihectatic fusiform aneurysms using the Acherorex stent and making the wall of the artery covered with the metal, with making the artery more stable, and it prevents from growing. I think it's a quite nice principle of using braided technologies in such a complex pathology, but it's also possible to use the same strategy in treatment of aneurysms with the braided technology. Okay, now we are fully okay, it's stacking at the distal part, but finally everything is okay. Yes, at this part stent is fully opened. Just a second, I will decrease the radiation level and also will decrease the zoom. We don't need zoom so much. Now yes, unfortunately we have no cartridges for Verify Now, and now we are giving only ticagrelor because the resistance for ticagrelor in our population is in our treated population is nearly 2%, and for local generic for clopidogrel is 26%. That's why if it's possible, then we use which is more reliable, and Berlinta, which is ticagrelor, is more reliable. Okay, now we placed 2 stents and we covered the aneurysmal segment. Let's do it in this position. So, почти. Curious. We have one more patient. We have one more patient for today, and tomorrow we have 4 or 5 patients with the AVM, with aneurysm, with everything. Except stenosis, most of them with aneurysm and AVM. Mostly aneurysms. Yes. The small aneurysm with the braided technology, it will disappear. And the ophthalmic artery is in place and it's covered with 1 stent, and the cavernous small aneurysm is also covered with a stent. And the aneurysmal segment covered with 2 stents. Минус кресло. Так, okay, I will ask Davlet to do control CT. Кытыгы коёр. Чекик. It's minute 20:35. Now 9 minutes from the beginning. I think it's okay. At 9 minutes everything is okay. We can take out the guiding. And now we will wait for the control city. Тез шығып кетесіз ғой, мен тез басшы. Хорошо? Жаңа істеді ғой. Шайхметте істеді. Окей. Dear friends and colleagues, CT is ready. The brain is okay and patient is awake because of the local anesthesia. And now we can finish this case. I hope to see you in 20-30 minutes. The next case is brain aneurysm also. See you. Thank you.